Hi guys, I am back with another FMGE question, and this video will be different from the rest of the videos, and you will see how. So today's topic is ventricular arrhythmia. So what is this ventricular arrhythmia? So to explain it simply, our heart has four chambers. Okay, two upper atria and two lower ventricles. Okay, so during the ventricular arrhythmia, the ventricles, which are required for pumping the blood to the body, starts beating irregularly. Okay, so instead of contracting in a synchronized manner, the ventricles may beat too fast or too slow. Okay, or in irregular pattern. Okay, so this disrupts the heart's ability to pump blood effectively as the ventricle do not contract effectively, so the left ventricle won't contract normally and cause the blood to fill in the left ventricle. Okay, so it will cause a hypertrophy of the left ventricle and therefore causing the problem to our body. Okay, so so what are the causes of the ventricular arrhythmia? So it can be triggered by various factors, heart disease like coronary artery disease like atherosclerosis, okay, or previous heart attacks. It can increase the risk for the ventricular arrhythmia. Okay, often other causes include the i- 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 electrolyte imbalances, certain medication, and even genetics. Okay, so so the causes so the causes are the coronary artery disease, previous heart attack or heart muscle damage, structural heart abnormalities, low potassium or magnesium levels, so certain medications including some anti-arrhythmics and substance abuse like cocaine or amphetamine. Okay, so we have got types of ventricular arrhythmia. So we have three types of ventricular arrhythmia. First is the ventricular tachycardia. So this type of arrhythmia occurs when the ventricles beat too fast, usually above 100 beats per minute. Okay, so as you all know that the normal beat of the ventricle is about 6 60 to 100. Okay, so if it goes above the 100, then we call it as a tachycardia. Okay, and in this case the ventricles are beating too fast, so that's why we call it as a ventricular tachycardia. Okay, now ventricular fibrillation. So it is a life-threatening arrhythmia where the electrical signals in the ventricles become disorganized, causing the heart to quiver instead of pumping blood effectively. Okay, it's like all the points in the ventricle they contract individually. Okay, so individual, so our heart um it contracts like a syncytium. Okay, how to say that, like a single unit. Okay, like a single unit, but in this case the ventricles, the each part of the ventricle, that is the each muscle, they contract independently. Okay, so it causes the ventricular fibrillation. Okay, now premature ventricular contractions. So they are extra abnormal heartbeat that occur before the regular heartbeat. Okay, and this can be you can hear it uh, s- via the auscultation. Okay. Now, symptoms of ventricular arrhythmia can vary depending on the type and severity of the arrhythmia. Okay, so symptoms are palpitation. Palpitation, it is a sensation of a racing or irregular heartbeat. Okay, chest pain or discomfort, dizziness or lightheadedness, shortness of breath. Okay, fainting or loss of consciousness. Okay. Now, how to correct this ventricular arrhythmia? So, how do we treat this ventricular arrhythmia? We give a drug called the amiodarone. Okay, so this is the antiarrhythmic drug which can be used to treat the arrhythmia. Okay. Now, cardioversion, in some cases a controlled electric shock cardioversion may be used to restore regular heartbeat. Okay. You have seen in the movies like you know that defibrillator, like in the Shivaji the Boss movie. Okay, like when he dies. So yeah, that that is the cardio version. Okay. Now, implantable devices. In severe cases, devices like implantable cardioverter defibrillators (ICDs) may be recommended. These devices can detect and correct dangerous arrhythmias by delivering electrical shocks or pressing the heart. Okay. Now, apart from the things the physician can do, the this the steps to correct this arrhythmia can be um, can be made via the lifestyle modifications like quitting smoking, limiting alcohol consumption, managing stress levels, maintaining a healthy weight, and exercising regularly under medical guidance. Okay. Now we have the question, guys. This is the most um, important segment of our video. So, what is the most common cause of sudden cardiac death? So, we have four options. First is the cocaine abuse, second is the mitral valve prolapse, third is the cardiomyopathy, and fourth is the ventricular arrhythmia. So, pause and please try to answer this question because this question is very simple, and I have told you all the important points regarding regarding the ventricular arrhythmia. Okay. Now, let's talk about the cocaine abuse, as it is the first option in our options. So, cocaine abuse can lead to a wide range of physical and psychological and social consequences. Now, what does the cocaine do? Cocaine, it's a substance which inhibits the reuptake of the norepinephrine. Okay, so thus increasing the concentration of the norepinephrine in the synaptic cleft. Okay, so it promotes the adrenergic sympathetic nervous system. Okay, so we have three effects: abuse effects, cardiovascular effects. Cocaine can cause a rapid and irregular heartbeat, which we call as a ventricular arrhythmia. Okay, high blood pressure and increased risk of heart attack or stroke. It can also lead to narrowing of blood vessels, which can cause damage to organs and tissues. Now, respiratory effects. Cocaine abuse can cause respiratory problems, including difficulty breathing, shortness of breath, and lung damage. Smoking crack cocaine can lead to chronic coughing, lung infection, and respiratory failure. Neurological effects. Cocaine affects the brain's reward system and can lead to changes in the brain chemistry. Like this drug, it causes the dopaminergic um, system to lose its function. Okay, which causes the memory loss, disorders, anxiety, paranoia, hallucinations, and increased risk of seizures or stroke. Now, mitral valve prolapse. So, this is the second option. So let's discuss this option too. So, what happens in the mitral valve prolapse is a condition in which the valve between the left atrium and the left ventricle of the heart, called mitral valve, does not close properly. Okay. Instead of closing tightly, the valve leaflets bulge back into the left atrium when the heart contracts. This can lead to variety of symptoms and complications. Okay, so complications. So most people with the mitral valve prolapse do not develop significant complications. However, in rare cases, complications may occur, including mitral regurgitation. The backflow of blood caused by improper closure of a mitral valve can lead to mitral regurgitation, which can progressively worsen over time. Severe mitral regurgitation may eventually require surgical repair or valve replacement. B. Infective endocarditis. So, mitral valve prolapse it increases the risk of developing of infective endocarditis and infection of the heart valves. This occurs when the bacteria or germs enter the bloodstream and attach attach to the abnormal wall, causing infection. Arrhythmias. So certain arrhythmias like atrial fibrillation or ventricular arrhythmia, ventricular arrhythmia. Okay, so maybe more common in individuals with mitral valve prolapse. These abnormal heart rhythms can cause palpitations, dizziness, and potentially increase the risk of stroke. Now, cardiomyopathy. So, cardiomyopathy it's a disease that affects the heart muscle, making it weak, enlarged, thickened, or rigid. Okay. So depending on the type of the cardiomyopathy, we have three types of cardiomyopathy. First is the dilated cardiomyopathy. Second is the hypertrophic cardiomyopathy, and third is the uh, restrictive cardiomyopathy. Okay. So as the name tells us that the dilated, it means the heart chambers become enlarged and weakened, okay, causing the heart muscle to stretch, okay, and causing the more blood to pile up in the ventricles. So it causes the cardiomyopathy, dilated cardiomyopathy. Okay. Now, second is a hypertrophic cardiomyopathy. So it is characterized by abnormal thickening of a heart muscle, especially the left ventricle. Okay, hypertrophy means increase increase in the size of the cells. Okay, so so the size of the cell increases and causes the hypertrophic cardiomyopathy. Okay, and the restrictive cardiomyopathy, it involves it in this disorder, the stiffening of heart muscle takes place, and which restricts its ability to expand and fill with blood properly. Okay, so our answer will be ventricular arrhythmia. It is the most common cause of certain cardiac death. Okay, guys. Hope you liked it. Thank you, guys. Like, share, subscribe.